where 110 workers have returned negative COVID tests. Testing came after port workers were ordered off the Rio de la Plata, with health officials concerned about COVID-19 on board. Workers were cleared to return to the ship, but then ordered off again to self-isolate. It's also been revealed only 9 of the port workers had been fully vaccinated. Here's what COVID-19 Response Minister Chris Hipkins had to say about this yesterday, right here on Breakfast.
As we've been working to understand what's underpinning that, it is misinformation. These are not people who are watching the news every night and getting their information about vaccines from reliable sources. They're getting them from their friends or from social media or from other sources, from the leaflets that people have been dropping in their letterboxes. These people are causing enormous harm in the spread of that information. The information is wrong. It is not based in science or in fact. They're causing harm that could potentially lead to catastrophic consequences for people, including their death.
Yeah, so what is this information and where is it coming from? To help answer that, we're joined by Dr. Jagadish Thaker, a senior lecturer at the School of Communication, Journalism and Marketing at Massey University. Morena JT, thank you so much for joining us. How are you this morning?
Good, Morena, and thank you for having me.
Oh, our pleasure. Thank you for being with us this morning. Now let's talk about the survey that was done about our attitudes and also our intentions when it comes to the COVID-19 vaccine. Now, this was done in March and then again in May. So let's start broadly. What are our intentions and what is our attitude towards the vaccine?
So we've been conducting national sample surveys for the past 1 year. The Ministry of Health has been conducting national surveys for the past 1 year. And what we found is that the intention to get a COVID-19 vaccine is now that at the highest in the last 1 year is about 80%. So clearly there is sort of a strong motivation across gender, age, ethnicity to get a vaccine now. So that's good news.
Yeah, it is great news, actually. So, JT, we had a chat about this. I'm not interested in chatting about the details of misinformation, the kind of misinformation that's being spread, but it is important to talk about it in relation to vaccine hesitancy. So, where are we getting our information from and what makes us believe in it?
Yeah, so we have also tried to test what kind of messages would help improve people's motivation. And what we found is that not just outright misinformation, but also hesitancy stories such as, I don't want to take the vaccine because of side effects and such. So even hesitancy stories in news media tends to have as big an impact on declining vaccination as, outright vaccine hesitancy stories. So that's concerning that, we don't need outright misinformation, but even light touch hesitancy can decline vaccine intentions.
Okay, so let's park that then to one side. What's the impact of misinformation? How does it affect our decision making?
I think it clouds our judgment. It makes us a little more hesitant. It makes us postpone getting a vaccine. It decreases our risk perception. We feel, either the disease is not as powerful or the vaccine is not going to solve all those problems. What we found in May, for example, when we wanted to test again was if we provide misinformation correction videos, such as the video by Dr. Ravi Jensen from Auckland GP, so providing just that kind of information actually helps arrest the decline in vaccine intentions. So I think yes, hesitancy news stories do decline people's vaccine intentions, but corrective information also helps increase that.
Yeah, okay, so let's talk about that information. Let's talk about how that information is being communicated to people within communities. So what did respondents say about the communication, the official information being disseminated within the communities?
Yeah, so one of the most surprising and worrying findings from our May 2021 survey is that only a third or less than a third say they have heard the government's communication campaign on radio, a newspaper, and social media. Only about 4 in 10 say that they have watched it on TV. So that's really low rate. People are not seeing the government advertisements on these different media channels. It's also worrying because, a majority of the vaccine hesitant and skeptics are looking for information from the government. So between March and May, the number of people who are looking for information from government has almost doubled from 18 to 30%. So people want information from government, but they're not getting enough of it.
Yeah, so in that survey, you also asked them how that information should be put into the community. So what were the answers to that? What are people saying about how that information can best get to them?
Yeah, so I think here it's important to recognize whether it's an issue of access or attitude. So some people just want more, help with the access. Can I get a paid leave off? Can I get some support to actually go and get vaccinated? But with the attitude itself, that's a larger issue. Do people want their GPs to talk to them, their community leaders to talk to them? So it has to be more of a localized campaign to get those vaccine hesitants and skeptics. Whereas for the people who are already enthusiastic about vaccination, the mainstream channel information would help.
If more people had the right information, are they more likely to get the vaccine?
It's not so simple because it's not like a truth serum being injected to us. Knowledge alone doesn't help motivate people. I think we should also try to get in social norms, get the community members talking about it, getting vaccinated, with others and such. So I think just information alone won't help, but changing public attitudes, the social norms would help.
JT, you've been a fantastic guest this morning. I think it's certainly the first time I've had a conversation with you. Thank you so much. That was really interesting and incredibly helpful. Dr. Jagadish Thaker, Senior Lecturer at Massey University. Have a great day, JT. Thank you.
Thank you, and you too.